Yes, we are live on Facebook. So welcome everybody. Welcome Dr. Province. I'm Lauren Gates with Airway Health Solutions. And I love these spotlight segments that we do because we get to focus on our airway dentists. And Dr. Province, I'm thrilled to have you today because you're actually a newer dentist. You know, you just joined our mini residency in January, and then I believe you took the pedo course in February. So why
Wow.
don't you just tell us a little bit about your journey? Because it's been like a quick one.
Yeah, very quick. Yeah, so I got into tarot last year, and or a year and a half ago, and I started just doing a lot of scans and doing a lot of Invisalign. And for the most part, it seemed always to be the same. It was, retract IPR, bring them into position, and then put them in retention. And it just, if to me, something didn't seem right about it, because I went through that myself twice with orthodontics. I had bicuspid extraction on the top, and then retraction, and then that was in dental school. And then in the city in like 2004, I saw a pretty prominent orthodontist, and more of the same, to close the spaces. I said, can you close the spaces? And I had some bolt discrepancy, and more pulling and to close those spaces. And, then I ended up with snoring and sleep apnea, severe sleep apnea. So it just didn't work out well for me. So I thought to myself, why do I want to do that with my patients? Why do I want to pull their teeth in? So I just went down, and just started looking online, and went to Invisalign website to see what they had. And then there's where I saw, a video by Ben, and it was about TMD and expansion. And I just kind of caught my curiosity, and I watched it, and my jaw dropped. I'm like, whoa, it made so much sense to me. And so I literally called Ben. I called his
I
office,
know
and I
he
said,
gave me a message.
and
I remember.
I couldn't believe he picked, that he just got right on the phone. And I said, listen, I'm in a lot of Invisalign cases right now, getting ready to do some, advanced stuff. And I saw your video, and now I have to change everything. And he just goes, I feel your pain. He goes, it happens to all of us. It's okay.
Mhm.
And sure enough, I had to, have conversations with about 5 or 6 patients over the next 3 weeks that I'm, changing their treatment plan, and some of them needed expansion. They just were very narrow. So I had to kind of talk them through what a maxillary expander is. So, and then in more of that research, I saw that you had mini residencies. And so I signed up like the next day. I was ready to learn about it. Now, I knew a little bit about expansion because I had another orthodontic treatment in progress with myself, with another prominent orthodontist in the city, Bruce Greenberg, who's a great orthodontist. And I saw a little something about him doing expansion, but it was just in a different way than Ben had presented it. So, but I went to his office, had a full workup, and I started wearing an expander myself. And so I knew a little bit about expansion,
Mhm.
but I learned just so much more by watching Ben's videos and, taking the residency. The other video that really, helped me was the intercepting sleep disordered breathing, which is on the website under the mini residency tab. And I
Mhm.
watched that, and again, my jaw just dropped. The origin and development of malocclusion, and what we can do to prevent that. All in that one little video. I knew that that was for me. Um, so for me, having those conversations with my patients was very easy because I had been through the process of retraction orthodontics twice, and now my health has suffered for it. So it was easy for me to convey the message and really explain it. And I use a lot of pictures and videos to help my patients understand what I'm trying to teach them. They understand 10% of what I say, but they understand 90% of what I show them.
Right.
So having the Airway Health Solutions website was amazing because I was able to just give them the direction to watch any of those videos, and then they would have a much better understanding if they didn't quite get it from me. So because Ben does a great job of laying it out so clearly. So that's kind of how it started. but then it gets
Well,
deeper, real quick.
right.
So my son is 8.5, 9, almost 9, and he's developed an open bite, and his tongue is a little crazy when he eats, and I can see he's struggling when he swallows. But he's been going to the pediatric dentist since he was, 3.5, and she's basically just telling me, we got to wait a little bit longer till the permanent teeth come in. And as a general dentist, I thought that made sense. It
Right, that's
always
what we're
made.
taught.
So then I saw, a little bit about what Glenn was doing with pediatric patients. And then I signed up for the pediatric mini residency, and I'm happy to say that literally yesterday, I ordered my first expanders for pedo, and
Yay.
I'm always been the kind of general dentist that's like, keep the children out of the office,
Right,
unless you
right.
have to bring them. Now I will get into that more, but
Okay.
okay,
Well,
so
we'll
go
do
ahead.
a part two.
Okay.
We'll circle back a year later and see all
Okay.
the patients that you've treated. But, when we talk about your most rewarding experience, and when you're saying it's basically almost every day, and, you got almost teary-eyed, I got teary-eyed when I read it, because just tell us a little bit about how dentistry has changed for you.
Wow. It's I can honestly, I've taken all the courses. I've taken all the Pankey courses, and I've worked very hard at being a good general dentist, making sure I
Mhm.
understood biological width and understanding, canine guidance and protrusive guidance, and making sure all my cases were built up, to be stable and predictable. Like, that's my whole thing, just be as predictable as possible. And so, and making an occlusal guard to protect what we've built. So I've always, been down that path, but I guess I've never really felt confident that I understood why adults have so many problems. Because I've always felt that, like, I feel like adults have so many issues that I don't understand. TMJ, I don't even treat TMJ patients for other than making an occlusal guard. I just, pass them on. It's a headache I don't want, but I never understood why there's, so many issues, root canals on teeth that have never had a filling,
Mhm.
serious recession and bone loss. Now, I know that orthodontics can cause a lot of bone loss and recession. And I know that eruption can also cause bone loss, depending on how the teeth erupt. The bone is thin, and then over the years, the tissue is, brushed away. And so, it's not always, iatrogenic, bone loss. It could be natural as well. But I never understood really why this all was happening, So now in my practice, and when I see patients, I really feel like I have an understanding of why their problems have become what they have been, and so just having that knowledge makes me so much more confident as a general dentist, and knowing that I have the ability to actually, improve what's in their mouth, and make it so that it truly is predictable and stable, rather than a kind of a, smoke and mirrors, stable, if you know what I mean. So
Wonderful. And since our course, like, let's just start with the adults, because I know you just had your first expander coming in yesterday for the children. But how many adult expansion cases have you done or are in the process of doing since the course?
right now, I counted, I have 10 expansion
Nice.
cases going. And, I'm now in the second month of the first patients that I put into an expanders, and, so they come in once a month, and I do, as we've gone through the protocol, I adjust it with them, and we try them in, and,
Mhm.
I'm just about ready to start taking some photographs. I can already see, more premolar in their smiles, as far as symptoms and in relieving symptoms that they've had, it's hard to say that. I mean, I
Right.
really haven't seen a whole bunch of that. None of my patients really have severe symptoms. There's a lot of sinus issues that I see, that I hear about, and some migraine, some TMJ. And as I talk to them about it, I say, listen, I'm not treating the symptoms, as Ben has taught us. It's like, I'm treating, a narrow arch or underdeveloped arch. So
Right.
underdeveloped is kind of a tough word for me to say to them sometimes, but I
Right.
just say just a narrow upper arch, which is
Yeah.
holding everything back. So
Well,
it's going
what
well.
Dr. Moralia coins it as is maxillary deficiency syndrome.
Yeah, yeah. It's a good term, and I love these terms. I just like to be a little bit more softer with them so they don't
Yes.
feel inadequate.
Right,
Nobody
right.
wants to be deficient
A
or
syndrome.
underdeveloped. I just say, listen, you just have a narrow arch. And what's great is that I can explain how it happened. So, as
Mhm.
you know, and this is another part about being a different dentist, the slide, the presentation I put together, I show many patients that now when we talk about this, when I can see it in their eyes, they're really curious, and so I can go through the history of how this has happened and how it's no one's real fault. It's just that it is what it is, and what we can do now is just we can treat that for adults, and more importantly, which is blowing my mind, is for their children. I have a young clientele, and they all have children around the ages of 4, 5, 6, 7, 8, 9. And the information that I'm helping them, that I'm giving them, is, I think, going to be just invaluable to them. Whether I treat their children or not, they're going to have some knowledge. And so as a dentist, to be able to, help my patients' children, I mean, I think that that's the most important thing I can do. I mean, that's it. They're the next
Absolutely.
generation. How many generations of snorers and sleep apneic patients are we going to have in TMJ patients? So we can start the process now of educating our patients, um, you know, for their children. I think it'll obviously help out in the long run. And I'm showing that presentation to all my specialists too. I'm meeting with my endodontist in a week and a half, and my oral surgeon. So they're coming in, and I'm just letting them know what I know, because if I know it and I pass it to them, they can pass it on. So
That's how it all starts. And then
right.
that's how you raise awareness. So we're really excited that, we kind of gave you the wings to fly, but wow, you're flying high and you're
Well,
really creating a nice niche for yourself in Manhattan.
yeah, I guess, it's just very, it's hard not to get emotional about this, as you
Yeah.
know, for some reason, but I think because it's so personal to me, because
Mhm.
I've been through this, and my son's going through this, and he was basically mistreated, that, I just think that it has to stop, it just has to stop. We have to educate the people that we know.
So for those patients who are watching, where can they find you? And maybe you can just tell us your website and we'll type it in the chat. So if they want to get a consult, it's obvious how caring you are and how knowledgeable you are. So
Oh,
let them come find you.
well,
What's a great way to reach you?
I practice in the city. I'm at 49th and Madison. My what's my website? drprovince.com. Nice and
Okay,
simple.
great.
drprovince.com. Yeah, and we do have a Province Shub. Province Shub. What's my Instagram? Province Shub.
I got you covered. We'll put
Got
it
okay,
on
good. Yeah.
there.
So my associate is Dr. Deborah Shub, and she is outstanding. She's finished the adult expansion course, and she's delivering her first expander next week. I'm very excited for her.
Me too.
And she's signing up for the mini pedo residency as well soon, so she'll be doing that. The whole office is, being educated on this. We have some great books now at the office. We have Breath, which is amazing. Jaws, another great one. The epidemic of, malocclusion. The Dental Diet, which is fantastic. And then there's GoPex. And GoPex is unbelievable. Good oral posture is so simple to teach children and adults, and
Mhm.
nobody really knows what that is. But it's a simple concept, lips together, tongue to the roof of the mouth, breathe through your nose.
Wonderful.
Basic, right?
Dr. John Mee was just on, as you know, last week,
Yeah.
and he's been preaching that since the 50s, right?
Yeah, it was a very
So,
good, it was a good talk. That's good.
I always like to leave with one piece of advice for dentists who are kind of on the fence or maybe intimidated by sleep dentistry. Like there is so much confusion with airway dentistry, sleep dentistry. What would be one piece of solid advice you could give a doctor who's looking for this, but's a little bit hesitant?
Well, I think there's a difference between sleep dentistry and airway dentistry. I think sleep dentistry, if you kind of go down that rabbit hole, or you kind of that part of the world, it's kind of like treating the snoring and the sleep apnea by giving them a mandibular advancement device. So that's sleep dentistry in my eyes. I think airway dentistry is just understanding that the more room they have in their mouth, good oral volume, the better that they're going to breathe all the time. So if they have a narrow arch and they can't put their tongue up to their palate, their tongue is going to stay back. And if it stays back, it closes the airway. That affects them all day and at night, obviously. So
Mhm.
I think that understanding that concept and knowing that by giving them the ability to have good oral posture, you're improving their breathing and their overall health and their sleep. That just comes with it. Making a mandibular advancement device is wonderful, if they need it, and that's all they can do at this time. It's a good start, and there are many different, appliances to use. I think that the CPAP is the gold standard for severe sleep apnea. I have to wear one of those right now, but I don't have to wear it as often because I do have better good oral posture with my tongue, and so I can sleep on my side, and my apneic, occurrences are almost gone, but I'll still
Wow.
snore. So I do wear the appliance. I do wear the CPAP while I'm going through treatment. Um, it's not that complicated. I mean, that's the
There
whole
we
thing
go.
about it. It is so simple to wear an expander and get some good, some transverse, distance from molar to molar, and it's not a big deal. Invisalign alone does it. You can do it with just Invisalign, understanding the concepts of expansion as opposed to, retraction. That's all you really need to understand. And Invisalign does a great job. Ben has great cases with with retainers alone, right? Um, but
Absolutely.
but it's limited. It's limited, and you're not going to get that palatal expansion that you're going to get when you use a removable expander. And the technique of doing it is simple, and it's not very time consuming. The lab, Kevin at Ollendorf or Specialty Appliances, they make great appliances, and they fit perfectly. It's not like they come in and you're going to have to do a bunch of crazy adjusting. It's
Mhm.
really very easy, and they're not hard to wear. And there's different types of the expanders, and 2 screw or 3 screw, which you'll learn about, and they're simple. I wear a 3 screw, and it's been great. My smile is
Yeah, we can
bigger.
both smile now. I have a
Yeah,
2 screw, you have a three
yeah,
screw, and
yeah, and
I can tell actually on
yeah,
you
it's
now.
it's
Yeah.
working. It's working.
Yeah.
But most importantly, I'm noticing that my tongue. It's. I know it
Mhm.
sounds crazy, but my tongue feels so much more comfortable when I put it to my palate.
Right.
So if you're on the fence and you're not sure, watch Ben's videos online. Take the mini residency. It can only help your practice and help you. I honestly, I don't know. I mean, I've been doing this a long time, so the same thing day in and day out, and not really fixing or treating the cause, it wears you down. It
Mhm.
just wears you down. So I feel like I'm treating the cause with the patients up for it, or just and if they're not ready for treatment, at least I have the knowledge to educate them on
Right.
what's
It's
going
their
on.
choice then.
It's their
Mhm.
choice. Yeah. And I have plenty of patients that are like, listen, that sounds great. I feel fine right now. And here's another interesting thing. So, and it's important to understand this, not all patients with a narrow arch have symptoms, have problems. They
Right.
don't.
Right.
But generally, those are the younger patients. They're
Yeah.
not older yet. The other
Mhm.
thing is a lot of patients who feel that they don't have an airway issue, that they sleep fine, everything's great. Ask them to download, it's called Sleep Recorder. It's an app. And I've already had 3 patients call after they've done this. I'm like, do me a favor. I need you just to record that, and you just download it, hit play, and then go to bed and see what it sounds like in the morning. And 3 have already reached out to me and said, you know what, I'm snoring. I didn't think I was
Wow.
snoring. So let's do that sleep test. So I have a lab that basically just the lab will call them and send the sleep test to them. And I've had 2 come back already. One has an AHI of 12.5 and one is
Wow.
6. Those
Right.
aren't bad, but they're not good.
Right.
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 Because the side effect of these issues are severe as we get older. It's a domino effect. So it's interesting what patients think and what the reality is are 2 different things. And if you can help them identify the reality, then you're just all you're doing is opening their eyes to what's happening with them. So easy thing to do: sleep recorder. Listen to yourself. Is it labored? Are you having a hard time? In patients that are having a hard time with breathing, will clench and grind. I mean, that's what the neurologists say,
Yeah.
and Gerard Simmons and a bunch of others, that when they put them up to a polysonogram, when the airway resistance is off, the clenching begins. They're in unison. So we know that clenching and grinding is an airway issue. So what can we do to fix that? How can we help them overcome that? So clearly
Well,
it's
you're a quick
sorry.
learner and a quick implementer and integrator. So
Yeah.
your patients are really fortunate to have you for sure. And
Thanks,
we're
Lauren.
just, I don't want to sound condescending by saying proud of you, but I'm so proud of you.
Yeah.
It's so nice to see someone take the information and then run with it to help so many people. So thank you,
Yeah.
Dr. Province, and keep up the great work. I'm sure we're going to have you back because we'll have some, cases to talk about. And then we'll both start crying, right?
Yeah. Well, real last thing I'll say
Sure.
about pedo, because pedo's really close to me right now. Over the last week and a half, I've had 3 conversations with patients where one child has all the symptoms of an airway issue. And here's the kicker: twin boys, 8 years old, right? And I'm just asking them about how the children are sleeping, how they're doing. Oh, they're doing fine, and this, that, and the other. The one has a little staining on their teeth from their inhaler. I'm like, okay, from their inhaler. Yes, he has asthma. How does he behave around the house? Well, when he's hungry, it's unbelievable how bad he gets. And, I'm like, what about nighttime? Any issues there? Well, he wets his bed from time to time.
Right.
So we have 2 children in the same house, twins. One has all of these things going on. The other one has nothing going on. And I go, let me guess. That one snores. And she's like, how did you know that? And sure enough, he's a heavy duty snorer, and, so they're going to be seen, by an integrative orthodontist and just get looked at, because obviously there's an airway thing going on, and we know how bad an airway is for children. They don't have reparative sleep, and then all these other things happen. So, and then I have another patient with a 4-year-old who has an underbite. She's like, yeah, she has an underbite. And I'm like, well, this is the time that we can fix that. We can start some myofunctional therapy. We can get them in the right direction so that this doesn't continue to develop, because once it fully develops, it's brutal to fix, right? We all know that class 3s are very difficult. So, and then another one, the same thing, son snoring really, really loud and very volatile around the house. And so what amazes me is that these conversations aren't happening earlier with the pediatric dentists and the pediatric doctors. And, I don't understand, where the disconnect is, but it is what it is. I got to keep it simple. It is what it is. I'm going to do my part. I'm going to educate as many people as I can. And, I'm just going to keep going down this path. So as you said, being proud of me, I hate to say this, but I'm proud of myself, because
no, you should be.
this is, I've learned so much, and Airway Health Solutions has been great. Not to plug it too much. I mean,
That's
I plug it as
okay.
much as I plug it to everybody who listens, but
Thank you.
an amazing, set of courses, and so well taught, just taught in a way that, can be implemented in the office, and that's what makes it so
you're
valuable.
living proof of it. 10 cases later in 3 months. That's amazing.
I hope in 2 years I can present all those cases to you. So
you will. I know you will. We'll have you back. So
Okay.
Thanks again for your time. Have a great weekend.
Okay,
And,
thanks,
we're
guys.
going to jump on Instagram Live now, so I'll see you there.
Okay,
I'm
bye.
going to call you. Bye.
All right, thanks, Lauren.
Bye.